Welcome to the Nursing Post podcast, all nursing all the time, with Ashley Moore and Rosa Horsley. In this episode, we are discussing superbugs. Of course, our goal is always to inform and help start conversation. So, a superbug is a viral infection caused by a bacteria that is resistant to common antibiotics. Misusing antibiotics, like not taking your full prescription, or taking them when you don't really need them, is the leading factors contributing to this problem, according to the CDC.
We love our stats. We always have to throw numbers in here. So each year in the United States, at least 2.8 million people get an antibiotic-resistant infection. More than 35,000 people die each year due to these antibiotic-resistant infections. It could be ranked the fourth leading cause of death, just behind, accidents. And that's according to Washington University that did a study, released it about last year, that estimated superbugs are responsible for as many as 162,000 deaths annually, which is more than twice as many deaths each year as occur from opioid and other drug overdoses.
That's crazy.
I read that and I was like, wow.
And it stems from a very preventable problem.
Not every sniffle
needs an antibiotic.
Exactly.
And if you get an antibiotic,
take it until you're done.
Right. So we kind of are coming at this from a little bit of a different angle. We know that superbugs are on the rise, but there are also super STIs. And nurses come into contact with these superbugs all the time. We say MRSA, C-diff, VRE. We all know what that is as a nurse. Mm-hmm. But we really don't talk about these super STIs. So today, we're kind of going to dive into a couple of the top super STIs and how it's really affecting.
It's not just young people, it's elderly too.
Exactly.
So STD transmission among the elderly is unfortunately now a common and growing problem. Between 2007 and 2011, chlamydia infections among Americans 65 and over increased by 31%, and syphilis increased by 52%. Most caregivers are surprised because they never imagined sexually transmitted diseases to be one of the many issues they could encounter when they're caring for an elderly loved one. What goes on in nursing homes, assisted living facilities, and other larger residential congregations of the elderly could almost be compared to that of, your college kids on spring break in a motel with a lot of people.
Right.
Like, it's hard to imagine that.
And most of us don't want to imagine that.
I worked in assisted living, so I know better. But I know a lot of nurses haven't, and they don't know what's going on. So that's why I kind of wanted to take a twist on this particular episode.
Right.
Seniors are contracting STDs at an alarming rate. And you will hear us say STDs and STIs. When I was in nursing school, that's what we called them, diseases. But now the likely terminology for it is infections. So you'll hear us use those back and forth.
Right.
We're talking pretty much about the same thing. We do know there are differences, but just for argument's sake. So seniors are contracting STIs at an alarming rate. The STIs or STDs cover the same spectrum as younger people. So everything from syphilis to HIV. In 2013, people aged 50 and over accounted for 27% of the HIV diagnoses in the United States. Professionals within the elder care industry are now more frequently and openly discussing this problem and the reasons for it. So we're wanting to bring awareness to the situation.
Right. Well, I think that that's one of our main goals of this podcast is to talk about things that we want to bring awareness to. We want to learn more. And yeah, it's a little uncomfortable to talk about, patients who are elderly and anything sexually transmitted. It's just kind of one of those things that
It's
most
taboo.
of us kind of like,
Yeah.
But that's the whole point of this, is to bring awareness. And if you don't know, you can't fix it. There are some risk factors for the elderly. There are normal sexual changes associated with aging. So this as things that we are very familiar with, it taking longer to obtain or even to get an erection, decreased vaginal lubrication. There's decreases in, sexual hormones as you age. There are men using ED drugs and women using, post-menopausal medications to help with, problems that they're having. But women are not concerned about getting pregnant.
Yes.
Therefore, this kind of turns into an issue with unprotected sex.
That's what it boils down to, really.
So they're fixing the problems of the erectile dysfunction, or
vaginal dryness, because there you can go to any store now and buy lubrication.
Right.
So
and nobody probably even bats an eye at
not
you.
anymore.
I don't know. So we're fixing those problems, but I don't think as nurses or providers we're saying, hey, make sure that you're having protected sex, because it's just not really something you're thinking about.
You don't want to think about your grandmother, your great grandmother,
right,
having sex in the nursing home or the assisted living. Yeah, nobody wants to think about that.
No. But as people age, their immune systems often weaken, so that really makes them even more susceptible to these infections.
Or any, when you think about it.
Well, any, but that includes these as well.
Yeah.
Exactly. There are psychosocial changes. So say that their partner, husband or wife, whatever, has passed and years have gone by and they're wanting that connection again. They've had it for years, they've lost it. And so because of them wanting that, with another partner, seniors aren't necessarily going to talk openly about that desire with their provider or nurses. I mean, because
it's even their family.
Right. Because they really consider this to be very embarrassing and they don't really want to discuss sexual issues with their doctors. And that can lead to even more infections.
And like you said, at this age, let's say you're 65 plus, you're in ALF or long-term care. There are doctors that are in-house or on site. How many of them do you know ask those patients if they're being sexually active? I can't say with 1,000% or 100% certainty that that question's even asked.
Me either. And with seniors, I think already live most of their lives. They're usually, if they're in this situation, they probably have lost a loved one or, they've been sexually active. They're, a grandparent. So I think the tendency can almost change a little bit for what we really would consider risky behavior. So a lot of seniors who were already married when sex education really started to gain momentum, they never really learned to express themselves. I don't think they really learned what we would consider the safe sex talk. Years ago, it was, you just don't have sex until you're married. And when you're married, it doesn't matter if you have a kid.
Yeah.
But
it was never talked about. It was very taboo. You had the hippie era, free love. It was never really concerned. There was never really a concern or talked about back then.
Right.
So now they're in a whole new world, a whole new generation, and they weren't taught the safe sex practices that we, the younger generation, had through school, through home, and etc.
Right. I mean, I'm in my mid-30s and I remember very open conversations in health class when I was in high school. They weren't trying to prevent us from having sex. They were trying to educate us on safe sex.
Exactly.
There was a big difference. It wasn't one of those, oh, you just don't do it. Don't think about it, don't talk about it. It was, okay, you guys are eventually going to do this if you're not already. So this is how to be safe about it.
Which is different from how I was raised. Yeah, we had sex ed, but it wasn't until high school.
Right.
And it was a very taboo conversation to talk about at home. I have never, ever spoken to my mother about any of this at all. She would probably look at me like I had a third eye growing from my head if I tried to, because that was the generation that they grew up in.
Exactly.
They grew up in abstinence, which is always the best policy, but it's not realistic for our generation and generations coming after us.
Exactly. And older people are using online dating. They're starting to branch out, I guess we could say, and use this other options. And there are significantly fewer older men available. So women can have multiple partners.
Well, I worked in assisted living. There are a lot more females, I would say, than males in the assisted living. So if the ratio of men is low compared to the high ratio of women, I mean, it could be a field day for a guy.
Oh, absolutely. These baby boomers are coming to an advanced age. And I think that when they were younger, that's when the 60s and the 70s were happening, and they were a little bit more open
and free
at that time. And I think that it's like, oh, well, that's what they know. That's what they're going back to, is those times where they were younger and free, and now they're just older and free.
Yes. And there's nothing wrong with free-spirited. Just be safe. Be a safe free spirit.
Exactly.
Yeah. So one of the STIs that we want to talk about is gonorrhea, and it has this like fancy Latin name that, most medicine and disease processes have that I can never pronounce. So I will not even attempt it.
Yep.
And just let you know that there is a bacterial strain that causes gonorrhea, which has previously been easily treated with antibiotics. However, as most things do, like viruses and bacteria, they mutate, they change, they either adapt or die, right?
Right.
In this instance, they've adapted and it's become more and more resistant to antibiotics. Some of the signs and symptoms of gonorrhea in females are you might not have any symptoms at all. You could have painful or burning sensation when urinating. You could have increased vaginal discharge or vaginal bleeding between your periods. Males may also be asymptomatic, and they experience, quite a few of the same signs and symptoms that women have. The burning sensation when urinating. They may also have a white, yellow, or green discharge from their penis. And they can also have painful or swollen testicles, although this seems to be like the less common sign and symptom. And for both men and women, because, this isn't the 70s and times have changed, you can get a rectal gonorrhea. And sometimes you might not have any symptoms. But for both men and women, they include discharge, anal itching, soreness, bleeding, and painful bowel movements.
I'll be honest, that's not something I thought about.
I didn't either until every time we do an episode, it's just like a light bulb moment. And I was like, I never thought of that. I would have never thought of saying that to somebody if I was teaching a class on gonorrhea or any other STI. I would have never thought of that.
Right, but we're not
it makes
public
sense.
Health either, so maybe that's something that most public health people would be laughing at us right now saying, oh, I have to have that conversation every time.
Oh, yeah, I'm sure they do, because that's what they do every day.
Right.
Times have changed, that's all I can say.
Yes, they have. Or another STI, STD. I'm from the STD.
Me too. I'm from the STD
era. It's chlamydia, and that's a bacterial infection that was easily cured with antibiotics. It's one of the most common sexually transmitted infections. Close to 3 million Americans are diagnosed with chlamydia every year. And you're looking typically at the age of 14 to 24.
That age frame threw me for a loop. 14 years old, you're in the 9th grade.
Yeah, I'm I have a daughter who's 13, so
It's scary.
I'm like,
It's scary.
gonna have to have a conversation. I should say I should have another conversation.
You'll probably have several.
Oh, yeah.
Yeah.
For men and women, you can be asymptomatic. So that's kind of, if you have multiple sexual partners, you need to be seeing a doctor regularly.
Mm-hmm.
But for women, you can have abnormal vaginal discharge or burning when you urinate. Men can have discharge from their penis, burning with urination, and of course, the pain and swelling in one or both testicles, but that's uncommon. And again, you can get rectal infections. They can cause, that can be no symptoms, but for men and women both can have rectal pain, discharge, or bleeding.
The third one we want to talk about is a new and emerging superbug. And I know I'm going to slaughter its name because once again, it's one of those medical Latin, terminologies.
Right.
Mycoplasma genitalium, also known as MGen or MG, is a sexually transmitted infection that's caused by bacteria. MGen transmission occurs if you have sex with a person who has already been infected with it.
Sure.
Which is pretty much how most STDs, STIs work, okay? Right. For men, it's often asymptomatic, but if you do have signs and symptoms, it would be urethritis, which is inflammation and swelling of the tube that carries your urine from your bladder to outside of your body. You have pain with urination, pain with ejaculation. You could have watery or cloudy discharge from the tip of your penis. Inflammation of the back passage, which is proctitis, and inflammation of the foreskin and penis. For women, it's basically the same as men. You'll still have, inflammation of your urethra, which causes pain on urination, soreness in the external genitalia. You can have increased or altered vaginal discharge. You can have bleeding between your periods. You can have inflammation of the cervix, which causes pain on intercourse and discharge or bleeding after intercourse. And you can have lower abdominal pain.
That sounds rough.
This has come about, and I'll go down here and keep going and telling you why. But this has come about because people would go in for STIs or STDs, be treated with antibiotics. They wouldn't finish their antibiotics. So then the one that they have that they thought was cured but not cured has mutated.
And now it's even stronger.
And it's stronger. It's not going to work with the antibiotic they were given before because they didn't finish it. So then they have sex with someone else. And then if someone else has a new strain that they just caught from the last fella, and then they don't take their medication and finish it all the way, that means it never went away all the way, which means it also mutated. And then it's a vicious cycle. And that's with gonorrhea, that's with chlamydia. And now that's what's kind of led to this new superbug. So most often patients that are given antibiotics for chlamydia, because this presents like chlamydia.
Right.
It's growing, but it's not as well known as chlamydia and gonorrhea. I didn't even know this existed until I started doing research for this podcast. And so you go into your doctor, you're telling them all your symptoms. They're like, oh, this sounds like chlamydia. So they're going to give you an antibiotic, right? Because that's what cures
exactly
chlamydia.
Seems practical.
Well, that's a miscalculation, and then the outcome is profound because you're not treating the correct STD.
Right.
Giving someone antibiotics with MGen builds the strength of MGen, making it more resistant to antibiotics. MGen could leave up to 48,000 women infertile each year.
That's crazy.
And it's not just this particular new STI that can leave women infertile. Gonorrhea can leave women infertile. Chlamydia can leave women infertile. Now, if we bring this back to the elderly population, they don't really care if they're infertile because they've already done that.
Right. But I'm sure that they care about, painful
Absolutely.
discharge, just, when something's not right downstairs. So,
Absolutely. And you know what I'm thinking is like if they're going to their physician and they're not telling their physician that they're sexually active, they're probably writing it off as a UTI.
oh, for sure.
It's very important to be honest with your physician because if you're being treated with antibiotics and they're thinking it's a UTI, but it's an STD, you're making that STD a superbug.
I think maybe what we need to do as nurses is make sure that and nurses and providers, that we're taking a better history. Maybe if an elderly person comes in and it seems like a UTI and that's what the problem is, make sure we're asking them if they're, sexually active, they have different partners, things like that, that we start screening them as we would maybe a young adult or a teenager, somebody in their late teens. I know when I was younger, if I went in and had any problems, it was either automatically I was pregnant or had an STD. And I'm like, no credit, none whatsoever. And there were times that I'm like, I'm not even sexually active. And they were like, well, we still have to do this whole thing.
I can imagine a lot of people lie about a lot of stuff.
Sure. I mean, even when I was having some, pelvic pain a few years ago and they were trying to work it out, that was probably about 6 years ago when I first started having trouble. I had to get a whole STD panel that was negative before they would even consider moving on to anything else. So maybe we just need to be like that across the board.
Well, yeah. And you know what? Being a former urology nurse, we really shouldn't be treating UTIs blindly. Like it takes 2 days for that CNS to grow out on a petri dish and to know which antibiotic is, resistant or non-resistant to whatever UTI that you have. So instead of just blindly treating somebody whom you think has a UTI and you could possibly have a super STI, maybe you should wait those 2 days to get the results before we start treating anybody with a bunch of antibiotics that they probably don't need.
Right. Well, and that holds true for a lot of things. If we as a healthcare community, of course, I know in the hospital setting that's a little bit different, but if you go to a doctor and you start doing your part as a patient to, I'm starting to have symptoms, something's not right, instead of waiting 2 weeks until it's awful to go to the doctor, go ahead of time, get your cultures done, and make sure that you're treated appropriately. If we make that the new norm instead of, well, it's been bothering me for a week. Well, I'm sorry it's been bothering you for a week, but we need to make sure that we treat you with the appropriate antibiotic because we're literally growing and making superbugs because we're just blindly treating everything.
I have a runny nose. I need an antibiotic. No, you really don't.
Most bronchitis is viral.
Yeah. I mean, the common cold is viral. If you have a cold, you do not need an antibiotic.
No.
There's a lot of stuff. There's just so many misconceptions about what needs an antibiotic and what doesn't.
Right.
Some nursing considerations that we think people should know, not only just for nurses, but even for patients as well. I always say have an honest, open relationship with your provider. And if you are too embarrassed to tell your provider that, you had sex and you don't know whether you have an UTI or an STD, then you need to find a doctor that you can do that with because communication is the most important dynamic between a patient and a provider.
Correct.
I also feel like nurses should be familiar with most STDs. Like I just learned doing this podcast about MGen.
Right. And I didn't know about that either.
I didn't either. So, I mean, I feel like we should consistently, and we're supposed to be consistently educating ourselves and keeping up with new treatments, new disease processes, new nursing considerations.
Right. Well, that's how you really become well-rounded and can help people in a multitude of ways. There's some nursing that I have no parts of and never have done, but I still need to understand basic concepts in disease processes because there are these things called comorbidities that my patients can have and I need to understand it and be able to process it.
Pieces have to match. It's like a puzzle, and the pieces have to match. even with that being said, we're talking about STDs and STIs that are superbugs, but I think people have to realize and remember that some STDs are not curable.
No.
Or very extremely hard to treat.
Yes.
So genital warts doesn't go away. Herpes doesn't go away. In HIV, even with new treatments and medication, that's still pretty rough treatment to have to go through. So
Right.
you always want to make sure that you're up to date and you know your stuff and that you're educating your patients.
It really is important. And we can, as nurses, start by recognizing some of these issues by taking an accurate sexual history. And if an STD is present, that we're actually educating and treating and explaining the process to the patient, especially if they're elderly. This may be the first time they've ever had any dealings with sexually transmitted anything.
Mm-hmm.
And I do think that it's the nurse's responsibility to do a lot of that counseling.
I'm not in disagreement with that at all, especially if you're living like in a long-term care or an assisted living situation. You see the nurse more than you see the physician.
Right.
Period.
And there's a better chance that you'll develop a better trusting relationship with the nurse if you've seen them over and over again.
Mm-hmm.
I think it does make a difference. There is something called expedited partner therapy, which is something that is supported by the American College of Obstetrician and Gynecology. Because of the incidence of gonorrhea and chlamydia reinfection, if the patient's partner is not willing or cannot come in to be seen to be treated for that infection, the provider, whether it be nurse practitioner, PA, MD, DO, whatever, they can actually give them another prescription to give to their partner to treat them, even though they've not seen them as a patient.
So that's new to me. I didn't know that.
Yeah, that started. It's not as well used because I think that there's a lot of, they're not my patient. I didn't see them. How do I know?
What if they're allergic? Things. Yeah.
Exactly. But what I've read a lot was the chances of them reinfecting and making a problem worse is greater than a physician blindly treating a patient's partner that they know they've had, intercourse with that has an STI.
Well, here are your options, right? No treatment. I went to the doctor. I got a 7 to 14 day round of antibiotics. Mm-hmm. I split it with my partner.
Right.
Or my physician gives me 2 prescriptions for the both of us.
Right.
I would take option C.
Right. But if you have somebody who's like, I'm not going to the doctor, they're not, and I think in my mind, and this may be my personal opinion, is I think women will go get treated a lot faster than men will.
I can see that.
And at that point, it's like, well, here's an antibiotic for you. Here's one for your partner. You both need to take it. And you go back and you say, hey, I have whatever. Here's your antibiotic and here's mine. And then whatever happens after that conversation is between them.
Yeah. The doctor's done his job or her job at that point.
Right.
Yeah.
But she stopped the infection from the patient and then she knows
and the spreader. Yeah.
And somebody who spread it. Exactly.
Yeah. As nurses, we need to educate our patients, our friends, and our families on the appropriate uses of antibiotics along with safe sex practices. Remember that the safest sex is no sex at all, but we're living in like 2020 and that's just not realistic. The next big thing is, wearing protection, using condoms, being safe, being monogamous. Antibiotics do not help cure viral infections. They can only help cure, bacterial or fungal. Mm-hmm. And you want to make sure that you're taking all your antibiotics as prescribed until all of the medication is completed. The only exception to that is if you're having an allergic reaction, and not a side effect, but an allergic reaction, which would include hives, rash, difficulty breathing, anaphylaxis, then you need to seek medical attention because that is a true allergy.
Right.
I want everybody to remember that every medication known to man that's in the med book causes GI upset, nausea, vomiting, constipation, and or diarrhea. And these are not allergic reactions.
No.
These are side effects. So know the difference. people who have stopped using their antibiotics because of the GI upset, constipation, and or diarrhea
Right.
are part of the problem.
Oh, absolutely. Again, we will link our references from this episode to our website. That's thenursingpostpodcast.com. You can join the conversation by leaving your comments on our website or on our social media platforms. Please subscribe to our podcast, and thanks again for listening to The Nursing Post.